Ma'am, we are live. We can start now. You can switch on your camera and unmute yourself.
Yes, ma'am. Hello.
So, very good afternoon, all of you. Thanks for joining. We have Dr. Oshin Agarwal today here. She has a 5-year experience with Apollo Hospital, Noida, and today she'll be going through us with the topic of webinar on hair fall. So, over to you, Dr. Oshin Agarwal, and thanks for joining in.
Hello, everyone. Good afternoon. Myself, Dr. Oshin. I'm MD dermatologist. Right now, I'm practicing as a consultant dermatologist at Apollo Hospital. So today we are dealing with the topic of hair fall, which is the most common topic and the most common problem that we are facing these days. So first of all, let's know what is hair fall and how we can deal with it. So first and all, logo, you all know that hair fall is like yeah. So hair loss, we say it like hair loss. Alopecia is the medical term that we use. People know it by saying we are having baldness, we are having hair loss, but in a medical term, we say it as a alopecia. Alopecia is a generalized term that we use for all these conditions, in which we includes majorly 6 of the conditions in which male usually experience male pattern hair loss, which is what we say genetic. We ask our patients ki genetic history hai ki nahi, your parents, your maternal side, your paternal side, though they are having any of the issues, it's not always necessary that your direct parents are only having the hair fall, then only you will experience male pattern baldness. But even your uncles, even your late grandparents, they are also having these pattern hair loss, and you can have a history of genetic predisposition, then you can develop these type of hair fall. Then in females, we say it's female pattern baldness. Females usually don't develop complete baldness. They experience widening of their like hairline. They must be widening from the vertex area that we say, usually this area that we say the widening, the gap in between the hairline is increasing. Then we say it's a female pattern. Usually, female pattern hair loss is not genetic as such. It can be genetic, but most common cause can be like nutritional deficiency, stress related, or maybe some of the cases like female is going through pregnancy and all. So they might develop a predisposition to female pattern hair loss. Then the third comes alopecia areata. We have seen in our relatives or friends experiencing patchy hair loss. If there is a hair loss in a big bulk of patches, it can be a single patch, can be a multiple patch. You can see it in the scalp area or you can see it in the beard area. So these we say alopecia areata is an autoimmune disease as such, in which what happened, the antibodies start attacking to your hair. There's formation of antibodies. These antibodies can be formed as a genetic predisposition, or it can be start at any age. It can be because of stress, oxidative damage, or maybe because of any of the like diseases per se. If it starts autoimmune process inside the body and it start attacking your hair follicles, and you will see a sudden patch development on your scalp or maybe a beard area. Then these three, the lower three terms like scarring alopecia, it's mostly related to some of the skin diseases in which you can see a shiny scalp. Your scalp will become shiny, smooth, and the chances of hair development with the simple creams, lotions are very less in this case. We need to go for some of the treatments which are procedure based. Or this is mainly a complication of a disease which is going inside the body, which showing in the scalp in the form of scarring that we say. There's a layer formation on your scalp. Then the fifth one is anagen effluvium. Anagen is a growth phase of the hair. Hair have a cycle. Anagen phase, telogen phase, and catagen phase. Anagen is the growth phase of the hair, in which hair are mostly in the scalp. Most of the hairs are in the form of growth phase. So what happened when we are taking some medications, like we are going through a radiation therapy or we are taking cancer-based chemotherapy, these drugs start attacking the hairs which are in the growing phase. So we will experience increase in the hair fall of these cells. We will increase the hair fall of the anagen type of hair will be increased. Later on, I will let you know how the doctors diagnose that you are having an anagen hair effluvium or telogen effluvium. Telogen effluvium is usually what we say we are body goes through a stress or trauma or disease per se, So after the trauma is over, when the body start recovering, then you will see a effluvium increase in the hair fall of the telogen type of hair. In which what happens, like for example, we will say if your body is going through a pregnancy. In pregnancy, ladies experience a good healthy growth because in the influence of your hormones like progesterone, estrogen. But once the pregnancy is over, the second or third month of it, you will start experiencing severe hair loss. It's just because you're having a telogen effluvium, though it's very temporary, but you might experience a severe hair loss because your body have gone through a stress for 9 months. Now the body will start recovering. They will experience the hairs which are already being traumatized, which are already being loosened up from their roots. They will fall off. So you don't have to worry too much about it. It will recover soon with some supplements and medical supervision. But yeah, you will experience severe hair fall in that case. Like if you're suffering from typhoid or maybe some of the diseases, dengue, you get from surgical treatment, anything which the body goes through a stress, you will develop these type of hair loss. So as I discussed, androgenic alopecia, it can be a male pattern or female pattern. It's a genetic type of alopecia in which what happens, male hormones start attacking your own hair cells. There must be a receptors. You will see some of the, like if your parents are having a pattern baldness, not all the children are experiencing the hair fall. Some will experience that pattern and some will not. It's just because there are receptors that should be present on your hair. If the receptors are positive, then you will experience the hair fall will be there and there will be a pattern of the hair loss. Usually it starts with the bitemporal area, then it involves the vertex area, then the sides will go. Usually the occipital, the back area will is most of the time are spared because there's no receptors present there. So in case when we go for hair transplant in future, these hair which are being spared, they are only being transplanted from the back to the forward in front. So these are the concept behind the androgenic alopecia for the males. And in females, I told you there's widening of the hairline. So by this, you can see there's some type of genetic predisposition of female is going through some nutrition deficiencies. So you can cover up with, or we can give some of the supplements or medicines accordingly. That I will discuss it later. Then comes the alopecia areata. I told you it's an autoimmune disease. Your body cells start reacting to your own hairs. So you will develop these type of patches. It can be single patch or can be a multiple patches. It can involve your scalp or even your beard areas also as well. So these are the histological findings. Sometimes what happens, we have to show it in the histology. We take a biopsy, a skin piece, and we see it under the microscope, and then we will see there's some inflammation or redness around your hair follicle. The hair follicle is the opening from which hair comes out. So when we take a biopsy, there's a redness around it. So that how we identify that is a disease is alopecia areata. Then the third one is scarring alopecia that I told you is not a disease of the scalp, it's the disease of the body which shows on the scalp because of the internal issues. So it can be, there's different diseases as such, but this can be like scleroderma, lichen planus. These are the skin diseases in which this development of scarring, the tissue become hard, your follicles, your scalp become totally shiny and flat. The chances of hair to come out from this is very difficult. If you keep on rubbing your creams and lotions over the upper top layer, the hair will not grow back. In that case, you will see there's no difference of applying multiple lotions, and the patients come, they see even applying so many of creams, lotions, tablets, still the hair fall is not controlling, or they will not experiencing new hair growth. It's just because this layer is there, which is preventing hair from growing up. In that case, we have to break this layer. So we will do some procedures like needling procedures, some derma roller type of procedures in which we break this layer so that hair follicle can come back again, and we will see the difference. This is treatable. We have to treat the disease as per se. We have to give some medications accordingly to the disease, and then we can do some procedures side by side to cover up and to see the new growth. Then comes anagen effluvium. I told you the growth phase of the hair. So in that case, if you are like people are taking on chemotherapies or radiation therapies, they experience this type of hair. So how we diagnose as such? How we diagnose that which type of hair fall, or do you are having a significant hair loss or not? So first of all, there are 4 tests that we do. First is plug test. Then second that we do is a pull test. Third is scalp biopsy, and fourth is daily hair counts. So I'm starting with the fourth one, which is daily hair count. In daily hair count, we will say normally 100 hair fall per day is normal. And in the days you are using shampoos, like usually we say in summers alternate days, and in winters at least 2 times a week. So in that day, you will experience at least 200 to 250 of hair fall. So if you're counting your hair, like if you're counting the hair follicles, so then in case if you're experiencing hair fall less than these numbers, then it's not significant. You don't need a treatment for that. Then in case if you're experiencing more than that, and you see the hair falling on your pillows, on your everywhere, on your comb while you're combing, on your toilet seats and everywhere, in that case, you need a treatment for the like hair loss. Then we come back to pluck test. So I told you how we identified. We pluck the hair from the root and we will see under the microscope. So what happened when we see the hair from the under the microscope? There is a bulb below the hair. We have seen, maybe it's visible to the naked eye as well. There's a small bulb. It's an opening from here which hair grows. So what happened if there is a sheet present? There's a layer present which is only visible under the microscope. Then the hair is anagen hair, which is a growth hair. But if the sheet is absent, then it is a telogen hair, which is already a traumatized or stressed induced hair, which is already being taken out during the time of stress. So if the sheeted hair is more in number, we say it's anagen hair fall or anagen effluvium that we talked about. And if it's saying if the sheet is absent and the hair bulb is there and that number of hairs are increased, then we see it as a telogen effluvium. So it's mainly diagnosed with the histopathology. Then second, which we do in an OPD basis. What happens when a patient visits us on the daily basis, we usually do these pull tests. Pull test is what on the mostly we mark 3 areas, like mostly in front and 2 on the back. And we pull small amount of hair with normal pressure. If we pull more than 10 hair, in that case, we say a positive pull test. If 3 different hairs, if it's more than 10 hair per area, then we say it is a positive pull test. It means the hair is literally damaged and hair is coming out from the roots. In that case, you need a proper treatment. And the cases that, like I've told you, cicatricial alopecia, like scarring alopecia, if you have some scalp diseases like psoriasis, scalp psoriasis, where there's a red inflammation, or maybe seborrheic dermatitis, when your scalp is not healthy, the hair scalp is not healthy, in that case, we need a biopsy. We do or take a piece from the hair follicle area. In case of alopecia areata also we do, but it's clinically visible only ki the patches are there and the diagnosis is there. But in the cases where the scalp is not healthy, it's red, inflamed, and there's multi-scarring, then in case we suggest the patient to go for a biopsy. We take a piece and the histopathology, we comes to see the different type of layers of the scalp and we're able to identify the disease as such. There's multiple diseases like psoriasis of the scalp, which leads to red, inflamed, increased hair fall. There can be seborrheic dermatitis, increase in the greasy hair growth. So in that case, you can go for scalp biopsy. So now comes the topic about how you can prevent all these on the daily basis. On a routine basis, I will say just have for hair fall if you're experiencing an hair fall. Shampoos will not help you as such. They are mainly to prevent the breakage. Like if you're having a breakage and the frizzy hair type and the hair texture is not good, then you can try to change your shampoo or try to change your water. That people come, हाँ यहाँ का पानी ठीक नहीं है, that's why we are experiencing hair fall. No, that's why you might be experiencing the breakage of the hair, frizziness of the hair. But if you are experiencing hair fall from the roots, in that case, it must be because of your nutritional requirement is not like sufficient to the hair. What happens if your body is going through the stress, if your body is not covering the proper nutrition in which we cover multivitamins and your protein intake. But for hair, nails, and skin, the most important thing that we have to increase in our diet is the protein intake. So protein should be increased in our diet and we should add some of the multivitamins that can be vitamin B12, D3, and maybe multiple like biotin. Biotin, though it's a adjuvant, it's not always deficient. We get in a vegetarian diet also, we get a sufficient amount. But still, it's necessary to have a biotin-rich fruit, like anything. It can be nuts in the form of walnuts, almonds, It can be seeds as such, flax seeds are there, chia seeds are there. And we can increase protein intake by adding sprouts in a diet, soya bean, pulses, paneer, which is normal in a vegetarian diet that you can increase. And non-vegetarian diet itself, non-vegetarian diet is sufficient in the protein intake, or maybe you can increase your egg part. So these things will help you to get a balanced diet for hair to prevent the hair loss from the roots. Then how come you are treating your hair? That is very important. Like if you are using too much of heating tools, you're twisting your hair, rubbing it too harshly, you're combing your hair while they are wet. So in that case, you are damaging your cuticles. So in case of damaging your cuticles, the hair fall will be increased and the breakage will increase. So you will see a frizzy hair also, and the baby hairs, too much of hair which are just the roots are there and the length is not there. In that case, it's just because you're not treating your hair that properly. So I will ask you not to tie, not to do twisting, rubbing, pulling of the hair, not to comb in when they are in wet condition, or gently washing and rubbing them, and don't pull them too, and don't try to use white combed, like white toothed combs, because that will also help to prevent the strangling and all. And I will say ki don't tie your hair too tightly. What happened? You will like these days fashions are coming and people are tying their ponytails too high and tightly. So what happened? We say it's a tractional alopecia. In tractional alopecia, your hairline start receding backwards. It's just because you are tightening your ponytail too hard. Especially in children, we see people do come, they oil the hair and they tied them too high and tightly so that it not come into the face. Okay, that is fine, but you can make it a bit loose, because it will start not now, but within few years you will see a difference in the hairline. It will start receding backwards. So it's better to tie it very lightly. And don't use harsh chemicals on your like hair, like gels we say, and serums. Serums are good, but it should be medicated and should only be used on the roots, not on the shaft as such. Shafts you can use only for like conditioning purpose, and heat rollers, curlings and all, it's not recommended. And as such, for the hair oiling, I have to say, though, don't keep oil throughout the like overnight or for a longer period, because oil is just a conditioning effect. Oil just condition your scalp. So you can just massage the hair with the oil, and you can keep it for 1 hour to a 2 hour maximum. And then you can just wash it off. Because if you keep it overnight, or if you keep it for a longer time, it attracts dust and it can make your scalp itchy. And once your scalp is not healthy, scalp is itchy, and you will start experiencing hair fall with time. So this is a sum up of everything that I have told you. This like what are the problems alopecia you are facing? It can be hormonal, autoimmune, scarring, telogen. It can be, I told you, it can be stress related, chemicals, your harsh weather conditions, medicated related, and your age related hair fall. So now starting out with the my treatment that I have to discuss. It's first the androgenic alopecia. This is the genetic alopecia. So the only thing we have to understand, that hair will go with time. You can't stop them completely. They will go them, but we can only delay them or we can prevent them. So in both males and females, the only thing that we can do, we can delay the hair fall and delay the time of hair transplant. So what we can do, we can have a proper nutritious diet. This is the first and foremost thing. Second, then we can start on with some serums. Serums can be, these days, the serums are like procapil based, cuticle based serums, in which you can start, they promotes the new growth of the hair. And once you stop them, they will not increase your hair fall as such. They will just help you to promote new growth, and you can continue throughout your life. They are completely safe. Third compound that we usually recommend is topical minoxidil. It's completely safe in females and males as well. Minoxidil increases, it's a potassium channel block. It increases the blood supply to your hair roots. So what happens when the blood supply increases, the nutrition supply to the hair roots increases, thus it promotes the new hair growth. Then we give tablets like finasteride and all. Is a 5-alpha. This is an enzyme which helps you converting the male hormone to the active compound. I told you that why males are experiencing alopecia, because what happened, their receptors are present and their male hormones get converted into active form. This active form attack that receptors, and hair fall will be increased. So if the active form is not formed, In that case, the receptors will not be like receptors will remain empty and the hair fall will not increase. In that case, we give this enzyme inhibitor, which converts the male hormone to the active compound. So this enzyme inhibitor is a finasteride. So we can give it completely safe. There's no as such side effects like I have seen. You can take it for 1 year, 2 as such, but only after the recommendation from the doctor, not by your own. So these can be finasteride, dutasteride. These are the compounds that have been used. And there can be hormonal therapies as such, like potassium channel sparing diuretics or this, but these are not used these days. But the best compounds that can be used are like topical minoxidil for a period of time and with the doctor recommendation only, though it leads to bit scaling on your scalp. But yeah, these are alcohol based if they are, but there's few compounds which are made in the market these days which are not non-alcohol based. You can consult your dermatologist, they can recommend you them that minoxidil and finasteride. So there's no as such side effect. Initially, with topical minoxidil, you might experience increased hair fall, but just because when you start using them, your scalp become itchy, and there will also the hair which are already been damaged, they will fall off with time. But later on, with 2, 3, 3, 4 months of time, you will experience a new growth. And in the treatment for alopecia areata, I have told you there's a patches. So if the single patch is there, we usually recommend intralesional injections. If the patch is single, we inject over that area and there's antibodies which are present, they will be like killed. And the results, what happens with time, the hair will come back because the follicles are there and this completely results are almost 80 to more than 90% of the result is there. But if there's multiple patches, if the most of the scalp is involved, if there's beard areas is involved, in that is not possible to give multiple injections. In that case, we give systemic oral immunosuppressants. These systemic immunosuppressants do what they do. The antibodies which are roaming inside your blood, they kill them and they prevent the further increase of the disease as such. And with the topical tubes and lotions, you can see the new growth. But the only thing that you have to see that these oral things should not be used on their own and they should be done only a doctor recommendation. And though they have their own side effects, so it's better to be like we have to see in pros and cons and then only we can start these systemic medications. The disease as such is completely reversible. So you can consult for that and you can get the treatment done. Now, the telogen effluvium, I told you, is just because of the stress related, your nutritional deprivation, your body is going through some of the like disease. Then after 2 to 3 months of it, you see the telogen effluvium. In that case, the most of the treatment that we give is the supplements. That only is it's sufficient to cover up the damage because it's very temporary. Though it can be too much, but the only supplements and few of the serums will help you to increase and to promote the hair growth. So in that case, the most important, there are 5 tests that we go for is like CBC, your iron levels that we need to check, your multivitamins levels like B12 and D3 we need to check, your serum ferritin, which your iron stores, and thyroid. So these things should be normal inside the body for keeping your hair normal. So if in any of these tests are deranged, you will start experiencing increased hair fall, which is one of the symptoms, and others can be different according to the deficiencies. So like you can go for iron supplementations, multivitamin like biotin, which is basically for hair and nail. You can start that too. And a cysteine supplement, which are given these days for like 500 mg daily is sufficient. So these things will help you to not just improve your like hair fall also, they will also help you to improve your nail textures and your skin texture as well. So these things should be kept in check while if you're experiencing too much of sudden increase in the hair fall. Like usually this happens in females, like after they deliver the baby or after they get through a proper disease or maybe with the weather change, like if there's a seasonal like monsoon hair fall, in that case you can every yearly you can take these supplements, they're completely safe. But yes, I will say you just visit a dermatologist first and get the check that you require these supplements or not, or any additional things that you require, and then you can start on these supplements. So I told you nutritional requirement that we see, like protein is the must. Protein should be like in the form of protein powders with vegetarian protein source. I've told you like it can be your sprouts, your soya bean, paneer, pulses. There are multiple. And in non-vegetarian diet, there is sufficient protein. Eggs are there, so you can start on that. Fats are also necessary because in longer term, it can convert into the protein in the body. So small amount of ghee and all also required. And minerals, told you the most important is iron, zinc, which is very much important for the hair growth. And copper, like if you are experiencing premature graying of hair, like people who start seeing graying of hair at the age of before 25, in that case, you must be deficient in this mineral. So in that case, we give calcium tablets and copper. We say take in a copper jar, aluminium jar. You can start drinking water. This helps in preventing your premature graying of hair. And then comes the picture of my role of multivitamins. That can be vitamin B12 and B6 is the vitamin and the vitamin D3. If you're experiencing body aches and severe hair fall, most of the Indians do have vitamin D3 deficiency. So we can buy supplements also, we can cover up these minerals. And so these are the most important thing if you're experiencing the hair fall, the nutritional part. Then comes the picture of the serums, lotion, shampoos, which are very superficial things and they're mainly for the textural improvement. Okay. So by this, I finish my talk. Thank you so much. If questions are most welcome. Thank you. Right. So the question that we have seen is two questions. First is by Raja Sharma. I have used minoxidil for 5 months in eyes by dermatologist. So now it's been here for very much. I used to have heavy dandruff. Dandruff is still there. Okay, fine. So I have told you minoxidil is a compound which leads to hair increase hair growth, but only till the time you're using it. So whenever I start a minoxidil to my patients, I always counsel them that you have to use it lifelong. The only thing that you have to be very compliant with is this. With minoxidil, if you stop using it within 20 days, within 10 days also, you will see the same hair, increased hair fall because the hair which has been grown by the minoxidil will fall again. So what happened in minoxidil? If you are willing to use it for the lifelong purpose, then you can you can start using it. Otherwise, go for serums, which are the milder versions these days, and they can be used. And they can, if you stop using them, then you will not increase. You will not see the increased hair fall thing. And the second thing, minoxidil, I told you that it's an alcohol based. In most of the brands which it's available, it's an alcohol based compound. When it evaporates, it leaves the scalp itchy and scaly. So it might be because of minoxidil also. And secondly, if it's you are having a dandruff issues, then you can go for dandruff is what fungus as such. It's not the dry scalp. So if you maybe the problem that you must be facing that you may be oiling too much of your scalp. If you're oiling too much, that can be a reason that your hair dandruff is not getting cured. Then second, it can you can go for some antifungal course. And if you are still having a dandruff issues, maybe your scalp is oily. So once in a week, you have to continue using anti-dandruff shampoo, which are milder ones these days available, which will not alter your make your hair texture bad. So in that case, you can go to a visit a dermatologist for that, and I will definitely see it will hair dandruff will be improved. And skip if you stop using minoxidil, then I will I will ask you to skip to and go to towards the serums. The second questions that if there is like I'm having thinning hairline, a lot of dandruff, and I use Selsun shampoo for dandruff every and now and then. Okay, the dandruff issues I have told you. First of all, dandruff is just on a scalp, oily scalp, not on the dry scalp. So then first thing that you have to see is what? That you have to stop doing oiling too much. Then second, go for antifungal course. And third, if you are having a natural oily scalp, then you might have on and off dandruff issues. Then you have to continue a milder. Selsun is a good anti-dandruff shampoo, but it's a stronger version. So you can use a milder ones so that you can use once in a week. And then later on, once your dandruff is controlled, you can use twice in a month so that to maintain the dandruff problem. But if your scalp is oily, then chances of dandruff remaining throughout your life will be there. But by controlling all these things like oiling part and making avoiding too much of greasy things on your scalp, you can and even with the antifungal course, you can prevent it or can treat the dandruff part. White hair reason in young age. I told you graying of hair can be because of multiple issues. It can be because of your multivitamin deficiency, can be because of deficiency of vitamin B12, D3, selenium, and calcium and copper. And then second, it can be because of your genetic predisposition, because maybe your parents or some of your uncles and aunts, they are also having the same issues. You can have a genetic predisposition for all this premature graying. And third, it can be because the stress related, because of stress and the lifestyle these days, people experience premature graying. So these three, four reasons are there which can lead to graying of hair in the younger age. Then the question is there, hair fall, no hair growth on the side of corners. So side of corners, if you are like mostly these areas, we have to see, I told you if there is a scarring, we have to see if this follicle is present or not. I have to, if this layer skin is totally smooth, shiny, in that case, it means the chances of hair growth will not be there if there is completely, even you keep on using multiple, even expensive serums and minoxidil also. So we have to see it under the microscope, sorry, hand magnifying lens or dermatoscope, that if there is any follicle present or not. If the follicle is present, then the chances of growth will be definitely there. Because initially for 6 months, you can try on medications. And if it still is not improving with the medications, you can switch to some of the therapies which are available, like PRP, we say, platelet-rich plasma therapy, in which you take out your blood and we create your own plasma, which have the growth factors, and we inject it on every monthly for at least 6 cycles. And then you can go for that, or GFC therapy. There's growth factor concentrate therapy that will also help you to increase your, promote your hair growth and prevent the further hair loss. How we can avoid hair loss after 30 years of age, and especially when we frequently ride on our bikes across the city of meetings. Okay, fine. So what happened when we are bike rider, we use mostly helmets. So that friction leads to hair loss, especially on the corners of the hair. So they have seen because of the friction, then in that case, it's better to see that you don't oil your hair, don't use gels, don't try to use a cotton below your so that there's no friction with your helmet. If there's continuous friction, that also leads to hair loss over that area. Then like that we say frictional hair loss. So it's better to use a cotton handkerchief that you can use, any scarf that you can use so that prevent the friction. And fourth, that we say frequently wash your hair. If the scalp is oil, because the hair, because of humidity, the scalp might develop itchiness and scaling. So in that case, every alternate days, you need to wash it with the shampoo, and every day you can wash it with normal water. So that the scalp will not become itchy and the scalp remains healthy, the hair loss will be prevented. And with age of plus 30, I will not say plus 25 also, every yearly you can take biotin supplements like for 3 to 4 months every year. And also you can also, because they're completely safe, and you can increase your protein intake. That's it. Then I take creatine monohydrate as pre-workout, and I have been informed that friend it can lead to hair loss. Please advise. As such, because it's a totally subjectified thing. People, some have experienced increased hair fall, but hair fall as such because of this compound have not been seen. It might be because some of your friends might have experienced it, or maybe some of the studies are there, but it's not as such proven that this compound increases the hair fall. So, like there, you can increase, you can take this as a pre-workout on a regular, not on a regular basis, for a few, like on a alternate days or maybe. But yeah, hair fall may be because of another issues, not just because of this compound, because no studies as such, proven studies are there about this. Then dry hair without oil. People says hair growth not related with oil. Yeah. So hair growth, oiling I told you is not a growth promoting thing. It's just a preconditioning thing. Oiling will help you because it with oil we do massage. So massage will increase the blood circulation to your scalp and will promote the hair growth. So oiling as such, and it's a preconditioning thing that will prevent the breakage of the hair. Like before shampoo, we say you do oiling. for at least for 1 hour to 2 hour maximum. It will help condition your hair, and then when you wash it off, it will help to maintain the texture of the hair and frizziness will be prevented. But yeah, you don't need to do oiling on a regular basis and keeping it overnight, tie up beards with the tie your hair with the oil, because it will, I told you, because it will attract dust and make the increase the growth of the fungus, because fungus feeds on oil, and it increases dandruff. So it's better to avoid oiling overnight. And then comes diabetic people, which have protein supplements are preferable. For diabetic people, you can add on for small, in diabetes we say you can have frequent meals and very small amount of meals. So you can't take up sugary things, but yeah, small amount of nuts is not like totally asked to be avoided. Like walnuts, 2 3 walnuts, soaked walnuts, even your anjeer that we say, which is enriched in iron. Even for the proteins, you can take sprouts. Sprouts is completely healthy, so even for the people who have diabetic. Sprouts you can take on a regular basis in your breakfast. And even you can take paneer, small amount of protein, not saying in a bulk amount you have to eat, small amount of protein. For the protein, you can take paneer as well. So these are the mild protein sources that you can take. In these days, protein powders or protein supplements are available, which are sugar free too and gluten free too. So you can start on these. Even 1 teaspoon daily will be preferred. It's perfectly fine. Hello, ma'am. I need to know about water quality of if water salt has also effect on hair in a yes. Yeah, okay, fine. So yes, water do affect. I told you it will not increase the hair fall from the roots, because water it will affect your scalp as such. It will affect your texture and the length of your hair. So what happens? You will experience hair fall just because your hairs are breaking from in between. There's an increased breakage of the hair. So if the water quality is not good, if the water, like in we say Noida only, the water quality is not good, in that case the hair will become frizzy, hair will start breaking off. In that case, you can change to a milder version of salt-free water that we say, RO water that we say. You can use that one to wash your hair. But yeah, it's better to like don't depend completely ki hair fall is just because of the water change in the place. If it's you're experiencing hair fall from the roots, then the causes might be internal. Hey ma'am, I'm having a facing hair loss. I have good diet along with regular exercise, no genetic issue. So maybe the your like if you're having hair fall and it's not because of your diet and genetic issues and you are regular with everything, then you get some blood tests done that I've told you. Maybe the internal deficiency that you need to check on if you have it. So because vitamin D3 and B12 is mostly deficient in that case, we have to check it with that. Or secondly, it can be because of your like hair styling method can be a problem. Your maybe the way you're handling your hair, and the excessive dryness can be an issue, because if you're not taking water even sufficient amount, that will also lead to dehydrated hair strands and leads to breakage of the hair. There are multiple things that we need to check. If you even your scalp, we need to check if it's like healthy or not. If there is some we can go for trichoscopy and all. In that case, you will able to understand that why you're experiencing hair fall despite of all your no genetic predisposition and proper diet. Then the question is why there have hair thinning and scalp is not visible. Hair fall is too much, and I use L'Oreal MXNL, which has helped in 5 to 10% of hair regeneration, but still others issues exist. Can you please suggest some products? I have a doubt that I can suggest products on this platform. So because products name we can't see, but yeah, there are multiple Procapil base. Procapil is a very good compound that we are giving these days, which is a good promoting hair promoting compound. You can see different serums which are available in which this Procapil is present. This promotes the hair, and also when you stop using it, it will not increase the hair fall back again. So this you can start, even try supplements that I have mentioned like biotin supplements. There are multiple oral biotin supplements also available as an adjuvant therapy. You can start that too. L'Oreal very damaged hair, range a solution for me or something else? I need to check the texture of your hair. I need to check your scalp before that, so that I can suggest a proper. Otherwise, you can start a generalized treatment that I have mentioned it here. Like start with the supplements, serums, shampoo. You can change the shampoo if you're having a damaged hair. And so because in conditioning too, conditioning is completely, yes, you can do condition your hair just on your length so that you can have a proper shiny smooth hair. Shampoo is just for the textural improvement, it's nothing doing for the roots. Okay. Then hello ma'am, I need to know about the water quality. It's already been discussed. uh, ma'am, I'm receding front line, not too much visible right now, but now to stop, I'm having new hair as well, but growth is slow. Okay. तो like cutting your hair from the length is not an thing कि length cut करेंगे तो hair growth because hair grows from the roots. It's like if you're experiencing receding hairline, it can be because, like I told you, this can be tractional alopecia, tying your hair too tightly, maybe on your back. Or secondly, it might be some genetic issues, or maybe you're having frontal fibrosing alopecia, which is a scarring alopecia. But if you're noticing and normal growth coming back and baby hairs coming back, you continue the supplements. And still, if you're like after 6 months also of the treatment, you're not experiencing getting a desired result, then go for some of the therapies that I have discussed, like PRP or GFC therapy for 2, 3, 4 sittings. Also, they will give good results to you for your new growth. Doctor consultation required before using minoxidil? I will say any medical compound that we should be used should be taken only after consulting a doctor, because minoxidil, there are multiple brands available, there are multiple percentages which are available, like 2, 10, 12. So it's better to consult a doctor that which percentage that you require. Do you require minoxidil or not? And which brand to prefer? Like if you are using alcohol-based minoxidil, I told you, you will land up into scaly scalp. So it's better to consult a doctor for that, and how to use it, how to accelerate it, how to stop it, until how much time you have to use it. You should know everything about the compound you're using on your skin and hair. So it's better to consult even using a simple face wash to a simple shampoo before using it. Shampoo also, as such also, I will say don't experiment too much with your shampoos. If you are seeing with a one shampoo that you're seeing your hair texture is improved, then it's completely fine. Shampoo will not prevent your hair fall from the roots. So don't keep on switching to your shampoos, changing your shampoos too much. Now, how to maintain a healthy scalp after PRP? So PRP is a procedure which is an invasive procedure. We do a needle-based procedure. And PRP, I recommend if you're having a genetic predisposition for the hair fall, then keep on taking it every yearly for 3 to 4 sittings. And after PRP, the serums we put and the PRP solution is on the scalp. We ask not to wash the hair for 24 hours. And after that, your scalp is completely healed and fine. You can behave like a normal scalp. You can comb your hair, you can shampoo your hair. There's no issues because it's a totally OPD procedure. It's nothing a surgical procedure. So you can just maintain the healthy scalp with your supplements, protein intake, with the serums, and with the proper diet. And shampooing alternate days in these summers. Please suggest vegetables and fruits that help to boost hair growth, as I'm suffering from severe loss. So I've told you earlier also, like protein-based sources that you can increase in your diet, and iron-based sources like you can get all green leafy vegetables that you see, even your pomegranate juice, beetroot juice, anjeer, walnuts, almonds, even 3 to 4 walnuts and almonds daily will increase sufficient for your biotin intake. And then sprouts are a very good source of protein. Even your soya bean is good. So these vegetables, I would say all green leafy vegetables, because we make your plate to be colorful. Every fruit and every seasonal vegetable is good. It's rich in each and every multivitamins. So every vitamin is good for the body. Though it will not be directly good to your hair, it might be good to your skin. So don't just restrict your diet कि मुझे बस sprouts ही खाने को बोला. Just make your colorful like diet. Take all seasonal fruits. Every seasonal fruit is good. It's rich in some are rich in vitamin C, some are rich in iron, some are rich in vitamin B12. B12 is usually rich in non-vegetarian diet. People who are vegetarian, they usually experience severe deficiency in vitamin B12. So in that case, you can go for some supplements of vitamin B12 after getting a blood test done if you are having a deficiency. Otherwise, vitamin B12 and D3 is the only two things that you need to check regularly on a 6 monthly basis, that I will say. So that you will prevent your hair loss in that case. So then the hair loss and frequent alopecia areata in most cases. So, like for alopecia areata, if you're single or two patches, I said you can go for like injections, topical injections. But if you're like having frequent and too much involving too much of areas, you can go for systemic oral medications. That too only after recommendation from the doctor. And hair loss, I'm talking like everything you can start on. You can start on some supplements, serums, and shampoos just for the texture improvement. You can just visit a dermatologist first for your alopecia areata. Don't treat it by just like on your own. Hair loss fall is lot there and a hair loss in the middle of the head. Okay. So here for in middle of the head, it can be a reason like if increase of the parting, you have to, or maybe a genetic predisposition. In that case, you can start with some serums that I can recommend you once you consult me for that. So I can recommend you some serums, some supplements, and then you can start on that too initially. And then if it doesn't improve with the supplements and all, then you can come for the like a PRP or GFC therapies. And dry hair without oil, people says hair growth is not related with oil. I have already discussed this question. Can we use hair oil every day? No, I will not recommend that too. Hair oiling should mostly be done restricted to once or twice a week, not more than that. And that too, I told you 1 or 2 hours before prior to your head wash, and then wash your hair just to prevent the grease, just for the preconditioning effect and to prevent dandruff on your scalp. Any questions which I have left? Does whey protein causes hair fall? No, as such has not been reported like whey protein increases hair fall. Protein is good. Whey protein might increase your acne issues or maybe some of your like back acne, body acne, face acne. But as such, it has not been reported that increases hair fall. If there are new studies, I will do study and let you know. But right now, till now, I haven't seen any patient which having taking whey protein experiencing severe hair fall. So I will maybe have done with the questions. Any new questions? How to get rid of hair fall? I'm discussing it now. I've already told what precautions do we need to do. I've told you like don't treat your hair harshly. Don't use too much chemicals, too much of heating tools on your hair. Here, don't comb wet hair. Don't tie your hair too tightly. Take supplements in between. Take increase. Look after the proper diet. Keep on changing your shampoos too much. Don't experience like experiment with your shampoos. It may be good to your friend, it's not necessarily it will be good to you as well. So these are the precautions that you can take to prevent hair loss and breakage from your hair. So I'm done with the questions.
Well, I think we should wind up the session now.
Yes, ma'am. Thank you for the session. There's no more query. We can wind up now.
Thank you so much, madam. Thank you.
Thank you for having me.
Thank you all for joining. Thank you, ma'am.